We do have some pre-video questions on hypertension today. Question 1, high blood pressure can cause complications like a stroke. True or false? A blood pressure of less than 120/80 is considered normal. True or false? Exercising, like walking 150 minutes a week, can help reduce the risks of high blood pressure and reduce complications of high blood pressure. True or false? Hello, my name is Nathan Kakish. I'm an internist and I'm the medical director of the outreach program Cultivating Health Ministries. And today we'd like to talk about hypertension or high blood pressure. High blood pressure, also called hypertension, is a serious disease that affects nearly 100 million adults in the United States. It is often called the silent killer because many people and many patients don't know they have it. Over time, those who do not receive proper treatment can become seriously ill and even die from hypertension and the complications that are associated with it. What is high blood pressure? The term blood pressure refers to the level of force or pressure that exists within the arteries or the blood vessels. This pressure is produced by the flow of blood in the arteries. When the heart pumps blood through the arteries, the blood puts pressure on the artery walls. This is the blood pressure that we are measuring. What are normal blood pressure readings? A blood pressure is considered normal if it is below 120/80. And in this schematic, you can see the two readings of the blood pressure monitor and the placement of the blood pressure cuff on the forearm just above the elbow to properly measure the blood pressure. The top reading is called your systolic blood pressure. Your bottom reading is called your diastolic blood pressure. When the doctor takes your blood pressure, they give you both of those figures. For example, 120/80. Both readings are important. The top number, the systolic, indicates the force when your heart contracts and pumps the blood. The bottom number, or the diastolic number, indicates the force when your heart relaxes and fills with blood. Your blood pressure rises and falls throughout the day, depending on what you do. Slight increases in blood pressure are normal, but the higher the blood pressure, the greater the risk to your health. What is high blood pressure, or what is hypertension? Hypertension or high blood pressure is simply a term to denote that the blood is exerting too much force, or there is too much force being exerted on the arteries that the blood is flowing through. There are different classifications of blood pressure elevation. Our normal blood pressure traditionally is measured at 120/80 for the diastolic. It is considered elevated at 120/129, and it is considered stage 1 hypertension between 130 and 139, with diastolic readings between 80 and 89. Stage 2 hypertension is considered when a patient has a systolic reading of 140 or higher, and 90 or higher for the diastolic reading. And anything above that becomes more hypertensive crisis or more of an emergency. Any reading above 180 for the systolic and any reading above 120 for their diastolic is considered very high. Many people with high blood pressure or hypertension don't feel sick at first. The only way to check is to have your blood pressure checked by a doctor or other healthcare professional. We do prefer checking your blood pressure at the upper arm above the elbow. And with hypertension, you do have a 4 times more likely risk of dying from a stroke and a 3 times more likely to die from heart disease, especially if your blood pressure is high, uncontrolled, and untreated. The risk factors for hypertension include overweight or obesity, high salt intake, significant alcohol use, more than 1 to 2 drinks per day, a sedentary lifestyle or lack of physical activity, tobacco use and smoking do raise your blood pressure, and stress raises blood pressure readings. There are non-modifiable risk factors or risk factors that we cannot change, including our aging. As we age, our blood pressure tends to rise. Certain ethnic groups have a predisposition to hypertension or high blood pressure. A strong family history is a risk factor for developing hypertension, genetically linked, and gender can raise your blood pressure also. Males tend to be more predisposed to it, and diabetes or gestational hypertension or high blood pressure during pregnancies is another concern to look out for. What are the complications of high blood pressure or hypertension? It can certainly cause some problems with the kidneys, where it can affect the filtering mechanism and cause protein to be excreted in the urine and slowly deteriorate the kidney function. Strokes are a complication, including strokes that are hemorrhagic, where blood seeps out of the artery due to the high blood pressure. And hypertension also contributes to blockages in the arteries in the brain that precipitate strokes. In the eye, it can damage the retina or the film behind the eye and lead to blindness. And peripheral vascular disease or thickening in the artery walls and blockages over time can be another complication. The purpose of treating high blood pressure is to prevent the progression of the disease and to prevent some of the acute and chronic complications that can happen from uncontrolled hypertension, and to improve the quality of life over time by preventing some of those events that can affect the quality of life. How do I control my blood pressure or hypertension if I have it? Changes in lifestyle to reduce your risk factors, such as the modifiable risk factors, especially the eating habits. Start eating a plan based on the DASH diet, which is the Dietary Approaches to Stop Hypertension diet, which includes low salt intake, fresh fruits, vegetables, grains. Exercise is a significant helpful measure to help reduce your high blood pressure, 150 minutes a week. So that is approximately 2.5 hours in a week span to help maintain your blood pressure. And then maintaining a healthy weight does reduce your blood pressure readings also. It's important to know your blood pressure readings to avoid complications from high blood pressure, or to know if you have high blood pressure so that you are able to treat it and manage it. Don't wait for symptoms or signs of an illness of high blood pressure, because at that point it will be too late. That usually means there's some damage that has been done. Speak to your doctor, visit them regularly, and insist on having your blood pressure checked. If you do use tobacco products and are a smoker, please strongly consider quitting. There are several resources available through the state, through local agencies to help with quitting that will have a direct impact on reducing your risk for cardiovascular disease. Limit the use of alcohol, which can raise your blood pressure, and chronic elevated stress tends to raise your blood pressure also. Reducing stress levels, relaxation does tend to help lower your blood pressure. Pharmacologic treatments such as medications are individualized and must be prescribed by a doctor. Please don't self-medicate to try to treat your hypertension. There are several interventions that we already spoke about that are safe that you can take on your own. Thank you for your time. It is important that you work with your healthcare provider, nutritionist, and/or pharmacist to achieve your health goals with regards to treating and controlling your blood pressure. We do ask that you complete the final survey after this video to help us know if this was useful for you. Post-video questions. High blood pressure can cause complications such as a stroke. True or false? A blood pressure of 120/80 is considered normal. True or false? And exercising, like walking 150 minutes a week, can help reduce the risk of high blood pressure and reduce complications of hypertension. True or false?